Good afternoon and welcome to our OakBend Medical Center Happy Hour podcast. My name is Donna and I am your host. I am very excited to introduce our guest today as we speak about healthy eating. Brittney Minton has been a registered dietitian for 7 years. She received her degree from Texas Women's University. Brittney has been a part of the OakBend family for 2 years and currently serves as the lead dietitian. Welcome. How are you today?
I'm doing great. Thank you so much for having me.
Well, we are excited to have you because, there's all this, you go to the doctor and they say, eat right. Well, different people's terms of eating right are different. And we're hoping you're going to shed some light on how we can do this. So first, I kind of like to start with, what is a registered dietitian versus a nutritionist?
Well, registered dietitians practice medical nutrition therapy. They have to obtain a bachelor's degree from an accredited university where you study a wide range of things. We study everything from anatomy and physiology, microbiology, biochemistry, to culture and food or food service or food science. We're required to complete an internship and to sit for our national exam, which is 1,200 hours of supervised practice in clinical, community, and food service. 13 states require you to have a license to practice, and Texas is one of them. And you have to complete continuing educations every 2 years, state licensure, and every 5 years for your registration status. Nutritionists do not have to have any qualifiers or education or anything. Anyone can call themselves a nutritionist, and they typically shouldn't treat people with underlying conditions.
Good to know. That's interesting because I never quite knew the difference. So
I don't think anybody really does.
So why would I need to see a dietitian?
So again, dietitians are qualified to treat medical nutrition therapy. So we a lot of times work in hospitals preventing and treating malnutrition, which can exacerbate all underlying conditions, leading to longer hospital stays and, above all, more cost to patients. We work in oncology clinics, treating and preventing malnutrition, sometimes with feeding tubes or IV nutrition, or just using diet strategies to help with taste and texture changes or nausea and vomiting, or other symptoms that may arise that can affect your appetite. We also work in bariatrics, which is a weight loss surgeries, or we can do outpatient nutrition therapy for people with everything from diabetes to hypertension to just general weight management, food allergies, eating disorders, and learning to have a healthy relationship with food. Some dietitians even offer meal planning and write menus. We also do a lot more things, but
To name a few, right?
This is just to name a few.
So do you see patients on an outpatient basis?
Oh, yes. OakBend, we get referrals from doctors, and we even accept insurance. So what happens is patients will get a referral from their doctor, they'll send it to us, and then we put them on our schedule.
So the doctor tells you to watch your diet. And we all know eating lean meats, vegetables, and fruits is what you ought to be doing. But there isn't time. Or how do you prepare it? Or what is a portion size? What can I do?
Unfortunately, time is a commodity we all run short on. Keep it simple. That's the best way to follow a healthy diet. Think of your favorite meals and ways to manipulate the ingredients for your desired outcomes. What I mean by that is, if your husband's favorite condiment to eat on tacos is sour cream, but he's also watching his cholesterol or trying to follow a little bit more of a heart healthy diet, go for the low fat sour cream and still keep it the favorite in the house. Or if your son only likes mayonnaise and you're really trying to do the best you can as a parent, go for the low fat mayonnaise or the mayonnaise that uses avocado oil in place of, the saturated fats and things of that nature, But I will say this, some foods you don't necessarily have to do that with. For instance, I don't like low fat ranch. I would rather use a smaller portion of ranch than use the low fat ranch. Also, crock pots and batch cooking are a great way to save time and money. You can just throw it all in the crock pot in the morning. You come home and dinner's hot and ready. And also try keeping healthy snacks readily available. The things that we stress as a dietitian is definitely keeping baby carrots or blueberries or just snack foods already pre-portioned out and eye level visible. That way we're reaching for those more often than we're reaching for the chips. There's also apps out there now where you can scale your recipes for the batch cooking. Like Tasty is one that I like to use because it has really fun and interesting recipes, and I can put for 7 servings and it'll show the ingredients for that recipe for that size. Meal kit services are another way to try and eat a little bit better. Sunbasket is dietitian approved meals, so that's pretty cool. Mainly just keep it simple.
Okay. Well, it sounds like I can still have what I like, just modify it, because your doctor tells you, oh my God, you got blood sugar, you got all this, and you run to the store and buy all this healthy stuff you don't know how to cook and you don't like.
Yeah. Cooking Light is one of the sites I used whenever I was a young dietitian trying to learn how to cook, because it took regular recipes that we all eat, spaghetti, tacos, lasagnas, and it traded out ingredients while still keeping it tasting good.
Oh, wow. So there are so many diets out there, and you can get conflicting information. There's the Mediterranean, the low carb, there's Weight Watchers, there's Atkins, there's all this. But what is the right way? I mean, it seems like everybody's trying to get money for stuff, and it's just confusing.
There are so many diets out there. Unfortunately, I've studied most of them. Diets do not work. Research shows that roughly 80% of people who lose a significant portion of their body fat will not maintain that degree of weight loss for 12 months. On average, dieters regain half of what they've lost within 2 years. Really and truly, the 80-20 rule, balancing it out. 80% of the time, eat right and exercise. 20% of the time, indulge and go on date night. Really, for long-term health, you want to eat according to your taste and honor without restrictions. Think long-term lifestyle versus fads. Fad diets, as soon as you get off that diet, as soon as you start eating your normal foods, the weight will come back. Really, it's all about balance.
So what kind of bread should we eat? Wheat bread, you hear white bread, you hear refined bread, you hear...
Yeah, that really depends on your family's goals and needs. Does someone have a gluten intolerance? Does someone have diabetes, gastroparesis? There's many different factors that can go into choosing a bread for a family. The marketing industry is $1 billion industry, which designs labels to grab your attention from just a glance using buzzwords or colors. You really want to use the nutrition label on the back of the bread to determine whether or not it fits in with your family's needs. For a general healthy diet, you want to go for the whole wheat breads more often than not because of the fiber content. Fiber is good for us in that it helps us feel fuller longer. It feeds our good gut bacteria, and it also helps to lower cholesterol. If you're eating for just general health, look on the back of the label for greater than 2 to 3 grams of fiber per serving, and that usually is an okay choice. However, if you have a condition in which fiber is not something you should be consuming a lot of, definitely go for the lower fiber breads.
Okay. And how can I still go out to eat and maintain a healthy diet or a healthy way of eating? I'll change it.
Okay. So restaurants, they came out with rules for if you have more than 20 restaurants in your chain, you are now required to put the calories on the menu or online. So I would definitely encourage you to look at the menu before going to the restaurant to kind of develop a strategy or see what it is that you want to eat. Or you can order things you can control. For instance, fajitas. You can order the chicken instead of the beef. You can get the corn tortillas instead of the white tortillas. You can order the charro beans instead of the refried beans. Another good thing, and this one is really one that I employ a lot, is the kids menu. The kids menu is the serving sizes is that of an actual adult. The serving sizes of our dinners in restaurants are usually more than 3 times the amount than we should be consuming. Another thing you can do is order your favorites, the smaller version, or pair it with vegetables or a fruit cut. For instance, if you really want chicken tenders, go for the 3 chicken tenders and get a side salad with it, or steamed broccoli or something along those lines. Something else that I definitely encourage people to do is stay away from creamy things unless you already budgeted for it, because those are usually really high in fat and really high in calories.
Okay. So we're in a world where obesity seems to be taking over. Supersize everything. We're seeing more diabetes, heart disease, and we're seeing it even kids, younger and everything else. What is your overall advice as to how we get ourselves on track with the $1 million business trying to make money off of everything? And we tend to get real excited and jump in with all feet, and then we're done. So what is your ultimate advice?
Small, sustainable changes. If you're going towards a general healthy diet and lifestyle, making those small changes in our normal dietary patterns is what's going to help us to have the long-term changes. Again, we don't want to change everything all at once and then a month down the road be so miserable that you go back to enjoying life, because we want to enjoy life as humans. So really, it's small, sustainable changes that aren't that inconvenient. You really want to make it to where it's a convenient lifestyle as well. Because food is part of everything. It's part of our culture. It's part of our, it's in every facet of life.
And every celebration.
Yes, for sure.
So how would someone, let's say I decide, you know what, I need to see a dietitian. I need to get myself on track and I need some help. How would I go about seeing you?
You could talk to your doctor to get a referral, especially if you want your insurance to cover it, or you can just look up dietitians near whatever town it is that you live in, and it should pull up with all of the registered dietitians in the area. And you can see them without insurance as well. They do have flat rates.
How do I know I'm getting the right dietitian for me?
Dietitians will actually interview you to see if you're a right fit for them. Because there's so many different specialties within dietetics that you don't want to take on clients that aren't your specialty, or that you're not going to give them the results that they want. That's why earlier I said some dietitians will even meal prep for you, or plan out menus and all of that. And I typically am one of those dietitians that don't really like to do that. I like to teach you what a healthy diet is and what you should be looking for to fit in with your family needs. And then I like for you to go and do your normal recipes using our suggestions.
Awesome. Because I know everybody has a different style, just as every physician has a different style and everything. So it's important, if you're going to be successful, to find the correct person that feeds to you.
Yes.
And you're going to listen to and everything else. So we had met Dr. Vashani with colon health, and we've talked about heart health, and we've talked about diabetes. And the one common thing I keep hearing is diet. And so musculoskeletal problems like arthritis and those kind of things, diet can help with that also. So I think it's important that we talk to our doctors about, I need help. And it's not in a diet pill, and it's not on the website. I need someone to actually talk to. I suggest that our listeners take that time, if you feel like you're having a problem or you're kind of lost or don't know which way to go, and look up dietitians. We definitely have a good one at OakBend.
Thank you.
We will actually be putting her number and how to access, but the biggest thing to do is go through your physician. The office knows how to contact her and tell them you want our dietitian, Brittney, over at OakBend. and we can hook up with her and get everybody healthy. You want the diabetes to be manageable?
Yeah, that's why I said earlier, whenever you were like, what's the overall diet? Well, it's so individualized to your culture, your family, your disease state. There's just so many factors that play in that I can't just give a blanket diet that's, the most healthy. Although the Mediterranean diet is a dietitian favorite because it is higher in omega-3s and it emphasizes fiber and vegetables and fruits, and that one is definitely liked by most dietitians.
So I'm going to ask you a question off the cuff. Mm-hmm. What's your take on diet sodas?
Diet sodas, and dietitians base their recommendations off of the science. So the science has not shown Diet Cokes to be risky for us to consume. So I say that if your goal is to maintain, get better control of your blood sugars, diet sodas are a way to do that. But I would also say this: some people have allergies to artificial sweeteners, and they don't necessarily, break out in hives or anything. They'll just get, headaches, dull headaches, or just not feel quite right. So definitely, if you're having symptoms around Diet Cokes, then I wouldn't encourage them. But if you're trying to control your blood sugars or using them in place of, sugary beverages, then they have a place.
So is there anything else you want as a dietitian for our greater public to know about? Or just something you want to tell them?
Bad diets don't work. I understand that everybody wants to get healthy and all of this, and it is important too. If you need to lose weight or control your blood sugars, definitely it's important to do that. But you really want to talk to a dietitian about doing it, not following a fad diet, because a lot of times they're just not sustainable. The weight comes right back, and then you end up frustrated on both ends.
Awesome. Well, I want to thank you, Brittney, for joining us today. And a big thank you to all of our listeners for tuning in. Beginning now, set an intention and a relentless focus on living your life as the greatest person you can be in all situations. Please join us next week.
Thank you for joining us today on OakBend Medical Center Happy Hour podcast. We hope you enjoyed today's broadcast and invite you to email us at oakbendhappyhourpodcast@obmc.org with any questions or topics that you would like for us to cover. Remember, you can find us here each Friday at 5. Until next week, be mindful and stay healthy.